Hello, everybody. Today we're going to be answering common questions that I see online about drains, surgery drains, whenever you have top surgery. So I had drains whenever I had my surgery. I'm nearly 2 years post-op now, and I had the double incision top surgery with grafts with Dr. Scott Mosser in California, and I'll be showing you guys some pictures and videos of my drains, both emptying them out and having them removed at my post-op appointment. And so if that's something that you don't want to see, there's going to be timestamps so you can avoid those. Or if it's specifically while you're here and you want to skip and go see that happening, timestamps somewhere. You'll find them. Before we begin with all these questions, I'm going to go ahead and show you what my chest looks like now. Nearly 2 years post-op. And so yeah, we've got a cat down here too. Hello, Sebastian. Really happy with how things have turned out. Not very much redness left on the scarring. Sensation is okay, but that was never really like a priority for me. Very flat. I only have like a tiny dog ear on one side, which it's not big enough for me to worry about, so I'm not getting a revision. So let's talk about these questions y'all got about drains. Also, obviously, this is more like a personal experience thing from the perspective of a patient who went through the surgery. I don't have any, like, medical expertise or training. So if you're more interested in getting this information from, like, a doctor, one of the reasons why I actually chose my surgeon is because he's, like, really transparent and good about getting this information out to people. He's got, like, a lot of resources online. So first resource is his website, like, genderconfirmation.com, and he's got a lot of information about this. This is a page about drains. I'll be leaving this in the description. He's also got a lot of videos. He has a YouTube channel, and we'll be looking at that as well. So first question I want to go over is, what are drains for? Drains are a preventative measure. They're meant to help prevent the development of seromas, which is a buildup of fluid, a collection of fluid underneath the skin after surgery. According to Dr. Mosser's website, it's unlikely that a seroma would negatively impact the final result of your surgery, and the swelling in the fluid eventually gets like absorbed into the body over time, but it can take several weeks and it can be uncomfortable. And the aesthetic outcome of it, like in the first few weeks of healing, can be kind of like unappealing, I think. So, like, you know, if you go through surgery and you spend all this money and you go through all this, like, potentially some pain and inconvenience for sure, it can be, like, really disappointing to, like, get your bandages off and then you have, like, all of this swelling and fluid buildup. So drains are recommended for people who can tolerate them. If you are a person who feels like you're not going to be able to tolerate them because you're a little bit squeamish about this kind of stuff, or for whatever other reason, a lot of surgeons, especially I would say more reasonable surgeons, will be like, yeah, if you can't handle drains, then you shouldn't have them. And if you have surgery with Dr. Mosser, he says on his website that for double incision, it's up to you. If you're having the keyhole surgery or periareolar surgery, then the drains are required for those procedures. How long do you end up having drains? Usually about 7 days. It was 7 days for me, I think. Maybe 6. The big question is, do they hurt? Actually, most people just assume that they do hurt. I see so many people online who are terrified of drains, and I think that this is kind of like a selection bias a little bit, because if you have a problem with your drains, if your drains hurt, then you're more likely to, like, get online and post about it and, like, complain about it and ask questions to get some relief. But, like, if your drains are fine, if they don't hurt you, then you're probably not gonna post about it. So a lot of people see folks complaining about drains online. You know, it is the case that for some people it can be painful or uncomfortable, depends on, like, what medications you're taking and some other factors. But for me, personally, my drains did not hurt at all. I think that I might have had like a little bit more numbness than some people, and there's definitely some variation. Like some people have reported their drains hurting, just like while they're attached to their bodies. I think like for some people, the place where the drain enters, that can be painful for some people. Something that I would try to be careful of if you do have drains for preventing and alleviating like pain and problems with your drains is I've heard a lot of people say that like they walked past a doorknob or something and the tube, the drain, got stuck on it while they were walking, and so it like yanked on it while they were walking. And yeah, that sounds really painful. So I made sure that that wouldn't happen. Like what a lot of doctors do is they give you, what are they called? Clothespins, safety pins. And you're wearing like a medical compression vest or a binder after surgery before your post-op appointment. I had a surgical vest on the entire time until my post-op visit when they took it off. And so what you can do, and what you should definitely do, is make sure that your freaking drains are not dangling around. You should wrap them up, nice little coil, and use your safety pin and clip it to your surgical vest. You don't want to fucking have it stuck on a doorknob. No. That sounds really bad. Another thing is like doing something like that helps prevent any like weight from being on it. It's like there's no pressure or tugging or pulling. So doing something like that is a really good idea. You can't really wear shirts without with like a front opening. You have to wear a shirt that you don't have to put over your head whenever you're recovering. So what I did was I had a lot of flannels, and the flannels had little pockets. And so like if I was too lazy to clip my drains onto my binder, then I could still wrap it up and put it inside of my pockets. And so that was like a really easy solution for me. So what I'm going to show you guys right now is a video of my drains being removed. And what you'll notice is that like I don't say ow, I don't flinch. I say, oh, that was the drain, because I didn't really feel it. I maybe felt it a little bit, like it's underneath your incision, so like it kind of felt like it was like snaking underneath my skin, like slipping out from under my skin, but it didn't hurt. And honestly, like I barely noticed it. And I have read some people online say that getting their drain removed hurt, but that was not the case for me. I'm petting a cat, by the way. Sorry for the weird hand gestures. All right, so if you don't want to see post-op very bruised and like healing incisions and things like that, this is your chance to look away, and I'll tell you when it's done. Also, this is, you're gonna see the drain get taken out of my incision. So here we go.
Okay, take a deep breath for me and exhale.
Oh, that's the drain, right?
Yeah. Okay. We are good to go. So I put some bandages in there where I pulled the drain. When you shower later in 4 hours, you don't have to replace them. Okay, you can just remove it before shower, and then just, you don't have to replace it.
So yeah, you can notice my reaction there. I'm just like, that was the drain. I didn't fucking feel it almost at all. And I've also seen people ask online, like, when you get your drains removed, do you have to like get that hole stitched up? No, you don't. She just slapped a little bandage on it and it was good to go. So I guess the hole is just so tiny. Because, I mean, like, the drain is very, very thin. It's a very tiny drain. No stitching necessary. And I haven't heard of anybody having to get stitches for their drains after they've been removed, so I would assume that's not really a thing. Also, personally, I was on tramadol. I don't know how to pronounce the name of the medication. Apparently, it's an opioid. That was the category that I saw it under. Different surgeons use different pain medications, and what I recommend is use the medication that they prescribe to you. You don't need to, like, try to tough it out. if the medication works and helps you feel more comfortable, then you should be using it. However, a lot of pain medications can make you very constipated, so you might want to ask your doctor about that, like how to deal with that, because the most painful part of my surgery was the constipation. A lot of people also worry about drains being high maintenance because you have to empty them, but that's where the list ends. You just have to empty them. And my surgeon asked me to do that about twice a day, approximately every 12 hours. And so personally, it's about, I found it about as high maintenance as brushing your teeth 2 times a day. It also only takes about as long as brushing your teeth. Takes like a minute. What I had to do was write down the amount of fluid, the little bulbs that the fluid collects into. It has little measurements on it, and so I needed to write down every time I emptied it out, like how much fluid was in there. Because if you have like a whole bunch of fluid, then your surgeon might be like, hey, you need to keep the drains a little bit longer, we're gonna have to keep an eye on this or something. But for me, I didn't have that much fluid, and I was good to take the drains out after 7 days. So if you want some instructions, if you need a little bit of guidance on how to empty your drains, my surgeon has a video that I'm going to leave in the description, a link to. It's really not that hard. You just open up the little bulb, you pour it down the drain at your Airbnb or your hotel or your house or wherever you are, and that's all you do. You just pour it down the sink. And for some people, like, that can be like really nauseating and disturbing and make them feel queasy and stuff. So like if you need help, somebody else can actually do it for you. You don't have to be the person who does it. If you have somebody living with you or somebody who can come over and help take care of you, you don't have to look at it. Somebody else, if they don't mind it, they can do it for you. So I actually have a video of me and my girlfriend and my friend emptying my drains for the first time. And if you don't want to see that, go, this is your warning, don't look. How much in there?
I'm gonna say...
Oh, hey, that one emptied out.
It's going, yeah. Ooh. Collecting.
Nice.
So they're just trying to measure and like see how much is in there so they can write it down.
Let's say just 30 milliliter.
Just needed a little help from Gravite. And you can notice there were little safety pins on the bulb. Help from yeah, there it is.
As soon as you're ready, Riley, we will empty this one.
Are you ready?
Yep. Sorry, I was writing it down.
Maybe a little closer to the sink so it doesn't splash.
It's a lot more Oliver than I wanted.
Nice. Riley, is it grossing you out?
Looks like red dye.
It does.
Or red food coloring or something. Like, look in the drain.
I'm gonna make Easter eggs with it.
Should I stop filming?
Yeah. Probably should not make Easter eggs with human blood and pus. By the way, it's totally normal to have very strange colors, a variety of hues in your drains. Red is the most common. That's mostly what you're going to see, especially like soon after surgery. But I started seeing some yellow, a little bit of like a pastel green, and even some blue. It looked like the color scheme of crunch berries. It was very strange. But the nurse and the surgeon both assured me that it was totally fine. Okay, so that's pretty much it. If you guys have any other questions, leave them in the comments or reach out to me on Reddit or something. And I will see you guys next time.